Hi everyone, I am Gauri PS, lecturer, Department of Radiology, Global College of Allied Sciences. Today we are going to discuss about the topic angiography. So first we will be dealing about introduction, principles, procedure, application and complications. First, we look about the definition. That what is angiography? Angiography is a medical imaging technique that is used to visualize blood vessels after injection of a contrast medium. Next is about history. What is the history? Actually, this angiography method was developed in the early 20th century, and after that they have advanced with the digital subtraction angiography that is widely used in a diagnosis purpose and also in intervention purposes. Then next is about the principle. What is the principle of angiography means? That is, we will be using a contrast media that will be detecting, that will be absorbing the X-rays, so that the blood vessels will be becoming visible while imaging, and this images will be recorded by means of a fluoroscopy. That is, fluoroscopy is an live imaging technique that is used earlier times. The next is about types of angiography. Usually there are 5 types of angiographic method. That is coronary angiography, cerebral angiography, pulmonary angiography, renal angiography and peripheral angiography. So first is about coronary angiography. Coronary angiography is an angiographic technique which is used to visualize the blockages which are present over the coronary arteries, so that we can find out whether there is an abnormality while functioning of the heart. The next is about cerebral angiography. Cerebral angiography is also an angiographic examination or angiographic method for dealing with the cerebral vessels, so that we can understand whether there is any blockages or any aneurysm cases over the arteries or veins which are passing over the brain surface area. Next is about pulmonary angiography. Pulmonary angiography is also an angiographic method that is used to identify the blockages or to find out any of their gap or any of the difficulties that are present over the pulmonary arteries and veins. Next is about renal angiography. Renal angiography is also an angiographic method that is used to identify the blockages or any ruptures or any of their tear and tears over the renal vessels that is present over the kidney areas. And next is about peripheral angiography. Peripheral angiography is also an angiography examination that was done to find out any blockages or any of the abnormalities which is found over the peripheral veins and arteries of the body. So next is about the equipment. Usually we use the equipments which consist of an X-ray generator, fluoroscopic unit, catheters, contrast injectors and also monitoring equipment. So the contrast media, that is the contrast media we used are commonly iodinated contrast agents, that is that can be ionic or non-ionic. The use of this contrast media is to enhance the visibility of the blood vessels so that we can identify whether there was a blockage or not. The next is about procedure. So for this angiographic procedure, first we have to do the sterilization of the patient. So the patient and the room has to be sterilized. That is the first method. The next is that we have to prepare the patient. That is how we will be preparing a patient. That is, for preparation, we have to remove all the metallic jewelry from the patient's body. As we are doing this examination, that is angiographic method, we will be using the X-rays. So while X-rays are passing, if there is any metal ornaments or metal particles over the patient, so that it will be exposed on the image, and that will be causing several difficulties or disformalities over the part which we are viewing. So that has to be removed and the patient has to be changed to the hospital gown, and patient is advised to do fasting for 3 to 4 hours before the procedure, and usually a day before fasting is recommended highly. And next is about the catheter insertion. First, we have to do an IV line. That is, first, usually we will be making this IV line system over the groin area or over the elbow joint. So usually mainly we use is over the groin area for the catheter insertion, so that when we made an IV line over there, so that the catheter can be injected over this groin area and it will be reaching the region where they are having any deformities or not. The next is the injection of contrast media. After the insertion of the catheter, we have to inject the contrast media, that is the recommended amount of contrast has to be injected over there. And as the contrast passes through the vessels of the patient's body, the images will be taken rapidly so that we can find whether there was a blockage over the pathway where this contrast media travels. Then this accurate images will be found over the monitor screen, and that can be used by the radiologist and also the angiographers or the cardiologist to view the part where they were doing the angiography procedure. And after this procedure completion, the catheter has to be removed properly and the area has to be the puncture site must be cleaned and made such that no air or any other substance enters through those insertion site, as this insertion site is frequent for causing of any of the diseases. The next is about the digital subtraction angiography. It is also a method of angiographic procedure in which they will be doing the computerized technique. That is, first we will be taking then a plain image, that is, the without filling of the contrast media, we will be taking the image of those vessels. And next we will be taking a contrast filled over vessel image. And last, by means of the computer system, we will be subtracting the contrast image over the plain image such that we can find only the vessel which is filled with the contrast over the final image. That is, it will be removing the background structures and will be providing only the clear vascular images of the vessels which are filled with the contrast media. So this is the digital subtraction angiographic method. The next is about the application. Usually this cases, that is this angiography will be applied in the cases of diagnosis of vascular diseases, detection of blockages, aneurysm evaluation, guidance for interventional procedures, etc. Then notice the advantages. That is, it is high quality vascular imaging and it will be guiding the treatment procedures and it is usually minimally invasive method. And there are also complications over this angiography. That is, there will be allergic reaction due to the contrast injection to the patient. There may be bleeding or hematoma. There will be infection or kidney damages. So notice the radiation protection method. That is, we can use lead aprons and we can minimize the fluoroscopy time and can maintain a safe distance and can be using the proper shielding devices such as lead aprons, thyroid shield, gonad shields, lead goggles, uh, and also the lead gloves so that we can protect our body parts from over radiation sources. And next is about the recent advances. So what are the recent advances which was found in this angiography? That is about CT angiography, MRI angiography, 3D vascular imaging, AI assisted imaging, etc. Then next is about conclusion. So that from this we can conclude that angiography plays a vital role in the diagnosis and also the treatment of the vascular diseases. So angiography is an essential topic over the part of any of the angiographic studies. So it is highly recommended to be following all the safety precautions that has to be assessed for any of the surgery procedures. So that's all for today's class. Thank you.